Good morning, everybody. It's about 10:02, so we're going to go ahead and get started. Welcome and thank you for joining us for our Healthy Living Lecture event on Unlocking the Power of HAP Medicare through Henry Ford Health, hosted by Henry Ford's Senior Healthy Living Program. My name is Kyle Ingram, and I'm the Director of Sales for Government Programs here at HAP, and I'll be your moderator for today's lecture. For those who are not aware, HAP's a proud member of the Henry Ford Health family, making the health system one of the few integrated health systems in the state where healthcare provider and insurance company are owned by the same organization. This morning, you will hear from Ryan Combs, Manager of Medicare and Individual Sales at HAP. And in this session, Ryan will discuss Medicare plan basics ahead of the Annual Enrollment Period, or AEP as we all know it, which runs between October 15th through December 7th. Little secret here, today actually opens up the shopping window, so you can actually start to see the plans available for 2026 starting today, October 1st. And he will also cover the different parts of Medicare. So that's parts A, B, C, and D, that whole little alphabet of Medicare. Following Ryan's presentation, we're going to have a question and answer session. So if you have a question during or after the presentation, please do not hesitate to type your question into the chat box. And just as a quick reminder, this is public for everybody who's on here, so please do not share any personal medical information. Also, to ensure a smoother experience for all, please make sure your cameras are turned off, microphones are muted. This is being recorded and will be available to listen to again on the Healthy Living Lecture series at henryfordhealth.com/healthy living lectures. Now, I'm happy to introduce Ryan Combs.
Awesome. Thank you, Kyle. We will go ahead and get started with our Medicare discussion. A little bit about our agenda. We will cover, what Medicare is, the cost of it, what it covers, what the options are for you as a Medicare beneficiary, how to choose what is best for you as everybody's situation is unique. And just to reiterate, this is a public forum, so please don't put any personal information into the Q&A or chat. If you do have specific questions, we will have options for you to reach out to somebody where you can share more detailed information to make sure you're getting what's best for you. Then we'll also talk about what Part D is and then kind of what those next steps are. So ultimately, what Medicare is this is an insurance program provided by the federal government, and this is paid in a system that's paid for through the FICA tax. So every paycheck, when you see that FICA, that's ultimately what this is going for, is supporting into the overall Social Security program and supporting Medicare. It is administered by CMS, which is the Center for Medicare and Medicaid Services. Often hear to it referred as original Medicare, and when you turn 65, or if you're otherwise eligible, you receive your red, white, and blue card. That ultimately signifies that you have that original Medicare, which is Part A and Part B, and we will talk about what those are and what the differences are as we continue. To talk about who might be eligible, anybody 65 years of age and has enough credits. You have to have 40 credit hours through your working career, which is essentially 40 quarter credits. So you have to work 40 quarters out of the year, which is essentially 10 years to be eligible. You can also become eligible based on a spouse. And then anybody of any age that has end-stage renal disease as well as Lou Gehrig's disease, so ESRD or ALS, and then other individuals with certain disabilities as defined by Social Security disability. So many times those that have a disability and receive Social Security disability, they become eligible for Medicare after a certain period of time having that the disability that gets them that SSD. And then when you become eligible, there are potential penalties if you don't elect for coverage when you first become eligible for that creditable and you don't otherwise have creditable coverage. So the cost. So Part A for most people is free based on work history. So if you get those 40 quarters of taxes, you would have no premium. And then for those that earn less than 30 or less than those 40 quarters, they would have to pay a premium. And then for Part B, you'll see this grid down below, which we'll talk about. If you're under a certain amount, which is if you're an individual under 106,000 or less, 2025 rate is 185. They do anticipate that for 2026 to have a slight increase year over year. Those have not been officially announced, so I can't share direct numbers, but it is going to climb a little bit year over year. And then, the rest of this grid, depending on whether you're individual or a joint tax filer, you then are subject to what's known as the income related monthly adjustment. And that is what these are. So if your income falls in one of these other brackets, let's say you make, and it is a 2-year look back, but let's say you made $200,000 in that 2-year look back, your Part B premium would be, that $591.90. So just keep that in mind, as you're looking at this, that's where your rates could be different. Obviously not trying to scare anybody, but, talk to your financial professional, an insurance agent to get a better idea of where you might fall with this. What does Medicare cover? So, like I said, there's the original Medicare. You have Part A, and then you have Part B. So Part A is that inpatient hospital setting. You've been admitted into the hospital. The deductible amount you see here is the $1,632 per incident that you were admitted into the hospital. One thing to keep in mind, that will also see an increase this year. It's going to be approximately $1,700, but it has not been officially announced at this time. Part A also covers skilled nursing and some home health care. And then Part B is the outpatient setting. So you're not admitted into the hospital, your primary care. That has a $248 or $240 deductible per year, and that is anticipated to go up between $245 and $250. But again, those numbers haven't officially been announced. And then Part B covers 80% of covered medical services after that deductible. So if the doctor bills you $100, Medicare is going to pay $80, leaving you with a $20 copay if you have just original Medicare. With Part A and Part B, there's no maximum out-of-pocket coverage, and then no built-in coverage for prescriptions, dental, vision, or hearing aid services, as well as all the other things that aren't covered by Medicare. So that's where some of the options come into play. You really have, you can have original Medicare, you can choose that, but there's also 2 other avenues that you can go down. You can go down the Medicare Advantage route, which is oftentimes referred to as Part C. These are where organizations like Health Alliance Plan or HAP come into play. We have contracts with the federal government. We design plans that are competitive in nature, offering low to no monthly premiums. And then you can choose between an HMO network and a PPO network. And again, this is an opportunity where you can, sit down with a licensed insurance advisor, and they can show you all these different options. Many of these Medicare Advantage programs do include prescription drug coverage. There are some that don't, so be sure to, if prescription drug coverage is something you need, make sure you're, when you're doing your review annually, that you're keeping that in mind. They do include a maximum out of pocket. And that's, compared to original Medicare where there's no maximum out of pocket, this puts on a cap on how much you can pay in a given year. And then they have additional benefits such as dental, vision, hearing. Some will include fitness benefits and things like that. And then you have to have a eligible enrollment period. So as Kyle alluded to, as we were kicking off, we are in the shopping phase starting today for that annual election period, or AEP, as you'll often hear it referred to as. So starting October 15th through December 7th, you are able to choose a plan, and anybody that is Medicare eligible can make a move during that time. But there are also other periods that Medicare Advantage open enrollment period that takes place January through March, which allows for those that are in Medicare Advantage to make a one-time move. And then there are special election periods as well, such as moving out of a planned service area, losing eligibility for certain types of coverage like Medicaid and things like that. But then the other avenue you can go is as a Medicare supplement, or otherwise known as Medigap. You'll kind of hear both those terms used depending on who you're talking about. These, much like the Medicare Advantage, are designed by plans such as Health Alliance Plan, but the plans themselves are basically the same across the board. So if you choose a plan G or a plan N or any of the plans that are available, CMS has designed and ultimately administers those plans. And then so with those, the plans are standardized and then offered by us, the insurance carrier. They do usually carry a higher monthly premium. They operate on the Medicare network. So if a doctor accepts Medicare, they will accept that Medicare supplement. And then the Part D portion has to be selected separately. So you would have to go get a standalone Part D drug plan. They do not have an out-of-pocket maximum. And oftentimes there's no additional benefits. So there's no dental, vision, hearing, any of that extra that you get in the Medicare Advantage. But you can apply anytime during the year, but it would be subject outside of guarantee issue periods, which is typically when you're first becoming eligible for Medicare. You would be subject to medical underwriting. So you can either get non-preferred pricing and or denied in some cases across the industry. And then ultimately, how options work. So you can, like I said, when you turn 65 or you otherwise become eligible, you become eligible for original Medicare. You can do Part A and Part B, and then you ultimately choose if you want to go down one of those other paths. Keep in mind, with original Medicare, you still don't have that Part D coverage, and there's no maximum out of pocket. You can choose to Medicare supplement or Medigap, as we talked about. These cover that 20% left over by original Medicare. And then you would have to choose a standalone Part D plan that'll cover your prescription drug coverage. And then some will offer, options to have dental, vision, and hearing coverage separately. Or you can choose Medicare Advantage, otherwise known as Part C, and that will combine A, B, many supplemental coverages, and most oftentimes Part D coverage. Again, there are plans out there for those that otherwise have Part D through like the VA or one of those other services that provide that to where they can choose a plan without. But for most people, you're going to want to choose a plan with Part D coverage. Ultimately, knowing what's best for you, when you're sitting down and reviewing this every year, you would want to ask yourself a few questions. Are your doctors and the hospitals that you would go to for your needs, are they in network? Are your prescriptions covered? Are there changes to your medical needs? This is something you should review every year. Doesn't mean you need to make a plan change. You don't need to make changes year over year, but it's something you should absolutely take a look at every year, especially if your medical needs have changed. Maybe you're seeing a new doctor. Maybe you've changed prescriptions. You just want to make sure. But then the other side is, things change on the plan side as well. And then do you want any of those or need any of those added benefits? So dental, vision, hearing are oftentimes the most common ones, but there are others that might be of need or something you desire to have. And those are the questions that you should be asking when you're sitting down with your advisor or when you're reviewing this year over year. And then just making sure that you're doing what's best for you for that contract year. And then each year when you're reviewing that, it gives you the opportunity to make an adjustment based on any of those changes, or, hey, I can stay put and I'm happy with this plan. It's working great. Getting into Part D, Part D prescription drugs. So you have the prescription coverage through Medicare, which is oftentimes referred to as Part D. You have a couple different options. Standalone prescription drug plans. Those are offered by, much like the Medicare supplement as well as Medicare Advantage. Those are offered by insurance companies, and they provide a formulary. And then you have Medicare Advantage, which oftentimes that Part D is included in those, and they would offer a formulary. And that's where, going back to that previous slide where you want to do your homework, is, are your drugs covered by the plan you're in, or the plan you're looking to enroll in, to ensure that you have the best possible coverage for you, and the things that you currently need or anticipate needing are covered by your plan. And this can be done, if you go to our website, hap.org. If you're working with an insurance agent, you can actually look at our formularies and verify, hey, is my drug covered? What tier is it going to be at? And then when you're looking at plans, those will also tell you what your anticipated cost is for the year. One thing to keep in mind as we move to the next slide, as part of the Inflation Reduction Act, there is now a maximum out of pocket for Part D prescription drug coverage. So back in 2022, the Inflation Reduction Act ultimately had some pretty big impact on prescription drug coverage. So starting in 2025, that was implemented for 2026, that maximum out of pocket will be $2,100 for your prescription drugs. That includes your deductibles and your cost share at the pharmacy. So if your deductible is, which is the max deductible, is $615, that's going to go towards your maximum out of pocket, and then the copays and co-insurances that you have for those prescription drugs. And then only prescriptions covered by your plan are applied to this cap. So again, going back to, are your drugs in the formulary? That's going to impact your maximum out of pocket. So if you're taking drugs that are non-formulary, that's not going towards your maximum out of pocket. And then it also introduced the Medicare Prescription Payment Plan, which is the M3P. This allows you to spread your costs of your prescriptions over the course of the year. So CMS released this information that only those with drug costs over $600 in a month benefit. So basically, this is for those that are taking higher cost drugs, and allows them to spread that out up to that $2,100 maximum out of pocket. So if you're taking a drug that it has a pretty significant price tag, rather than having to pay that entire cost share at one time, it allows you to spread that through the year into 12 installments or less, depending on when you sign up for that program. Looking at next steps, so are you in or near an enrollment window? The answer is yes. Starting October 15th, we are in the AEP period or annual election period, and you have the opportunity to select your plan for the 2026 plan year. One thing to keep in mind for those that maybe are just now turning 65, there are penalties and delays can occur if you miss that enrollment window. So if you don't enroll in a plan right now and you get beyond that enrollment window, if you're newly eligible, you may have to wait until the next annual enrollment period or otherwise another special election period. So keep that in mind. And then, for those, again, I know we're kind of talking at the eve of annual election period, but, for those that aren't already Medicare eligible and you're planning ahead, if you are looking ahead towards your retirement or turning 65, as we review the next slide, you're going to get an idea of what that window looks for you, and then you can start to plan for that. So keep in mind, 3 months prior to your 65th birthday, you will become eligible to enroll into Original Medicare. It won't become effective till the first of your birth month, but when you turn 65, but you can start to plan for that at least 3 months out, and you can review this further out. Just know that 3 months is when you can start to select options. So you have a few different enrollment periods that are kind of standing. Initial coverage, so that's the 3 months before, the month of, and the 3 months after your 65th birthday. So if you're turning, like myself, you're going to turn 65 in July. You're going to have not only the month of July that you turn 65, you're going to have June, May, and April before your 65th birthday, and then you're going to have August, September, and October after your 65th birthday to elect your coverage. So again, plan accordingly, because if you're coming off other coverage, those have different rules. So if you're continuing to work past 65, make sure you're getting advice from licensed agents, various people that can provide, their expert advice on what the best move for you is, because I know people that continue to work past 65 or retire before 65, and this all looks different. So as you're planning for your retirement, planning towards Medicare eligibility, you can start to do your homework on what the best avenue for you is. Then you have your initial coverage gap, which is the first 3 months of your entitlement to original Medicare. Then you have special enrollment periods, which are 60 days before or after qualifying life event. So that's a 2 full month window that you typically have if you move out of a planned service area. You experience a loss of maybe Medicaid eligibility, or oftentimes other things are, sometimes there are 5-star plans that give you the ability to enroll. There's a variety of different special enrollment periods that you may qualify for, depending on your unique scenario. So those aren't like standing, you can use them anytime. You have to have a qualifying life event that would lead to loss of coverage. Annual enrollment period, which is what we're approaching, that October 15th through December 7th every year. And then you have open enrollment, which is January 1st through March 31st of every year. And that is Medicare Advantage open enrollment. So that is a one-time move for those that are in original, or that are in a Medicare Advantage plan. They can move to a one-time move to another Medicare Advantage plan, and or they can make that move back to original Medicare and elect for different coverages. They would have an SEP to choose a standalone drug plan. Oftentimes, the people that use this enrollment period, that Medicare Advantage open enrollment period, are ones that maybe didn't move during AEP, and then the new year starts and things either change quickly, or they realize, hey, I should have made a move. It gives you that one-time move to correct anything that you may have done during AEP. How HAP can help. Ultimately, HAP and Henry Ford are here to help streamline your care, reduce your costs, and when you're seeing your provider. So you can go to hap.org /Medicare to see all of our plan options. You can review those plan options with a licensed agent. We have a lot of, we have some internal folks, but we also have, a lot of partners throughout the community that are there to assist you as well. Or you can call HAP at 866-802-3634. And I know that's on the screen, so. And I think the next slide is questions, but I can't. It's not going forward for some reason.
Yeah, thank you very much, Ryan. Now we're going to go on to the questions in the chat. Move my screen here. All right, so the first question, Ryan, is what happens if I don't make a plan selection in AEP?
Yeah, so if you don't choose a plan during annual enrollment period, you would continue in the plan that you have beginning January 1st. And then you would continue with that. You should have received by today an annual notice of change. So you're completely fine if you're in coverage. You would continue with that coverage unless, you're otherwise impacted by, something happening, which you would have been communicated with you. But you would have that Medicare Advantage open enrollment period if you are in a Medicare Advantage plan, or the other SEPs if you do have to make a move based on one of those.
Great. And then we got another question here that says, I'm still working. How do I know if it's more beneficial to move to a Medicare Advantage plan or stay on my work healthcare plan? I just turned 65.
Yeah, that's a great question. So there's a lot of variables that can go into that, including the size of your employer, whether you should opt into Part B. So that's one that we would probably want to sit down and review a little bit more in detail. But ultimately, that is a choice that you have, because other variables come into that. Like, do you have family that also is on that coverage? Because some employers will won't allow you to keep that family covered if you leave the plan. So there's a lot of variables there. So it is something you would want to review with a licensed agent to get a better idea. But ultimately, that is I would say that's a preference on whether or not you stay in that group or not.
Okay, and then we had a follow-up to that one. Also, how do I choose, or let me see, how, also, if I do choose to stay on my work plan, how do I avoid penalties for not signing up for Medicare?
So that's ultimately where where the size of the group comes into play. Because depending on the size of the group, either Medicare will be primary or secondary. If it is deemed creditable coverage as well. So those are questions you can ask your HR professional or your benefits team at your employer, and they will advise on whether or not you have creditable coverage. Because if it is creditable, you would not have any penalties. If and then depending on the size of the group, you may have to elect for Part B, but can postpone due to creditable coverage Part D until you retire, and leave that group plan.
Yeah, and Ryan, if you don't mind, I'm going to add a little more context too. If when we're talking the size of the group, if you're less than 20 employees, you have to take Medicare Part B coverage. It's up to you if you stay on the group plan and choose a Medicare Advantage or a Medicare supplement to go along with that. But what he was getting to is if you speak with your HR professional, they should all have received by now notice whether or not their plan is credible coverage when it comes to prescription drugs. And you want to make sure that it is. If it is not credible coverage, then you're going to want to make a Part D or a Medicare Advantage with prescription drug plan to avoid that late enrollment penalty into Part D coverage. But of course, as we always suggest, speak with a local agent, call in to HAP if you'd like to ask questions on that as well. That is a personal decision based on your own situation. So we always think it's best to talk through the situation and see what's going on there. I'm just refreshing for some more questions.
I do see one. Are there any plans that are special to Henry Ford patients? Looking at that, yes, we do have a plan designed in partnership with Henry Ford Health. It is called the Henry Ford Select. If you'd like to learn more, I'll go back a slide here. Various options. If you're already working with a licensed insurance agent, give them a call. But we do have a plan, and the great part about those types of plans is it further reduces those types of partnerships with health systems. It allows us to further reduce your cost exposure as well. So you have great benefits at reduced costs.
Yeah, and I think one thing I want to add into that too is we will have multiple Henry Ford locations with agents on site throughout the annual enrollment period. So if you're at a Henry Ford location, you see that Henry Ford tablecloth, a nice blue tablecloth there towards the entrance at most of them, feel free to stop by and talk to that agent. They're an agent that's there willing to answer questions, help out, and walk you through that process. We do have another question that is asking one-time move. What does that mean?
Yeah, so if you're in a Medicare Advantage plan and you're in that Medicare Advantage open enrollment period that runs from January 1st to March 31st, ultimately what that one-time move is if I'm in, let's say, plan, I don't want to use plan A because that's going to create confusion if you know Medicare, but let's say I'm in plan ABC's Medicare Advantage, and whether I decided not to make a move or maybe I signed up for the plan and realize it's not for me as maybe something changes during that window, I have a one-time move where I could go choose ABC Co.'s Medicare Advantage plan. So I have an election period there where I can move from one Medicare Advantage plan to another. Or let's say I'm like, hey, I would rather go a different route. I could also go from that Medicare Advantage plan back to original Medicare and then elect through a special election period a standalone Part D drug plan.
Give it another quick minute. I don't see any additional questions in the chat here. While we're kind of waiting, Ryan, are there any typical questions that you see members having, especially this time of year when it's going into the annual enrollment period? There's lots of commercials, ads, all that type of stuff going on. Any specific questions or pieces of advice that you would have for members as they're going through this time period?
Yeah, I think going back to the questions, that we laid up, that you should, verifying that your doctors are in network, and I would advise, be cautious of the phone calls and the commercials. A lot of, some of those will promise more than is actually available in your market. There, there are rules around that, but ultimately just be cautious. Make sure your doctors are networked, your prescription drugs are covered. Be cautious with your information. Don't give out your Medicare ID number or your MBI as they may ask for it. Just be cautious. If something doesn't seem right, you can end that call, but making sure that your stuff is covered. And then beyond that, depending on the type of plan you choose, making sure that you're digging into that plan, utilizing the benefits, because ultimately that's what they're designed for, is to be used. As far as other common questions I get is that you see out in the market is, the cost. Sometimes, when you're looking at those there's $0 premiums, that's something we're able to do, through that process of designing the plan to provide benefits to you. So zero it doesn't necessarily mean there's no benefit. You do your due diligence, look through those plans, meet with an advisor, one of these avenues, the 800 number, meeting with a licensed agent, the Henry Ford staffing locations where you'll see that, like Kyle alluded to. They'll be able to answer a lot of your questions, but I think queuing up, and I'm trying to get back to that slide, but making sure all of your needs are covered in your plan. It is one of the times where, especially for those, like the question about I'm retiring, this is one of the first times people get to choose a plan based on their wants and needs. So I always advise people, like, do your due diligence for you. What your neighbor has may not be what's best for you. If you're a married couple, what you enroll in may not be what your spouse enrolls in. So just keep that in mind. This is a time where you're choosing a plan based on your healthcare needs, and you can do that.
Perfect. All right, and there's another. I'm going to go ahead and take this one. It says, I have HAP Advantage, Henry Ford Select, love it. Appointments for specialists and testing can stretch out. What are my options to go outside the plan for earlier appointments? And then there's a follow-up to that says, is there an option for a opinion outside of the system? So very good and valid questions. What this is going to take us back to is the actual plan itself and how it's designed. So the Henry Ford Select is a plan that we utilize a high-performing network that consists of just Henry Ford providers in that network. So that's what allows some of those benefits to be as rich as they are, and a lot of the options there. If you are looking to go outside of the system, there's obviously other plans there, but I would also speak to your provider's offices and see if there's a way, if tests are stretching out a little bit longer, and I can work with my counterparts over there to have some questions around that. But of course, with that plan, you do have to stay within the network. As any HMO is, you have to stay within the designed network. For options outside of Henry Ford, we have healthcare plans that are full HMO network. So it's not Henry Ford Select, but it has multiple systems involved with it. That is another option for you. And again, that's where we are talking about. Review your plan options with a specialist that can review your current needs and situations. That's a nice part about having the annual enrollment period every year, is your needs do not stay consistent year over year. So this is an opportunity for you to speak with somebody and see, is there a different plan within the HAP ecosystem that will work for you. Hopefully I answered the questions on that one. One other thing I think I would like to suggest, and actually while I'm thinking about it, sorry, we do now have with the Henry Ford family, those legacy Ascension properties too. So that network has gotten a lot larger with more opportunities. So that may be an opportunity to go just outside of your typical, the Henry Ford facilities you've been used to. That's gotten a little bit larger now with other opportunities. I don't see any other questions as of right now. I always like to end these things with a piece of advice or just a fair warning. This time of year is a time where you're going to get a lot of pieces in the mail. You're going to get a lot of phone calls. We do our best to work with CMS to help reduce and report things when we see that they're not right in the industry. But just know one thing, Medicare will never call you and ask you for your Social Security number or your Medicare ID number. They will never do either of those things. If you fill out a generic, we call it a business reply card, a little card that comes in the mail for more information or for them to send you information, you are going to end up on a call list that goes out to a bunch of call centers. So I just warn you at this time of year, if you are working with an agent and you get a phone call that seems a little bit off, just let them know you have an agent and reach out to your agent to ask about it. If not, just know Medicare, HAP is not going to call you to ask you to verify your Medicare ID number. There's a lot of things that are going to come out. So this time of year, especially, just be hyper vigilant around those to make sure that you don't get enrolled accidentally that you were not planning. Perfect. So I don't see any more questions in here, so that's going to bring us to the end of our event. For more information on HAP and Medicare offerings this AEP, please visit hap.org or call that 866-802-3634 number to speak with a licensed expert. As a reminder, this lecture has been recorded and will be available to watch again or share with friends and family members. Visit henryford.com/healthy living lectures to view the presentation, and the recording will be available in the next couple of weeks. On behalf of Ryan and HAP, the Healthy Senior Living Program, thank you so much for joining us to learn more about Medicare and this year's AEP. I hope you all have a great day.